For the skill, you will have an EMT partner to assist you. You are required to treat any initial life threats and verbally treat all secondary injuries discovered. You must physically palpate the patient as you would in the field. As a lead EMT, you may direct your partner to complete tasks during the assessment. Your EMT partner may use any of the equipment available at the station during your assessment. You will have 15 minutes to complete the skill. You may now take 2 minutes to prepare. If you are finished before the 2 minutes are up, please let me know when you are ready to begin. Do you have any questions?
No, sir. Why is she wet?
It's
And
lubricant.
Nice.
Any product.
Did you guys just miss the mouth? It's supposed to go in the mouth, not
I
around
put
the
it.
mouth.
I put it all in the mouth.
And she threw it.
She rejected.
She said she was gonna mouth.
Wow, that's a chill for failure. What's that? I bet it's open too. It is open. That dog reads and this guy just goes.
You have one over there.
I should get my pink one. What? Ready.
Okay. You responded to the scene of a 24-year-old male patient who was in a house fire, ran out in the street, was shot and attacked by a gang. Law enforcement has secured the scene.
Alright, BSI is my scene safe.
Yes.
Number of patients is 1. My mechanism of injury is house fire, gunshot wound, and assault. I will have ALS on standby, and I will have my partner take and maintain C-spine stabilization throughout the duration of this call. What do I see, smell, or hear?
Male patient lying supine on the street.
Hey sir, my name's Staff Sergeant Hatch. This is my partner, Sergeant Harvey. Can we help you?
No response.
Okay, sir, if you can hear the sound of my voice, go ahead and squeeze my fingers.
No response.
Alright, I will squeeze the trapezius muscle, looking for facial grimace.
Patient grimaces.
Alright, my patient is responsive to painful stimuli. I will scan my patient's body, looking for any life-threatening bleeding. Do I see anything?
You see a deep laceration with steady flowing blood from an open wound on the right side of the neck.
Okay, right side of the neck with a gloved fingertip. I will go ahead and apply a occlusive dressing. Is my wound managed?
Yes.
Alright, do I have any other injuries?
No.
Okay. Alright, I will have my partner open the airway using the jaw thrust maneuver. Is my airway clear?
Blood in the airway.
Alright, I will go ahead and suction my airway. Alright, I will turn on my suction container, ensuring 300 millimeters of mercury. I will kink my tubing, insert it into the patient's mouth, release my kink, and suction in a circular motion for no longer than 15 seconds. Is my airway clear?
Yes.
Alright, I will go ahead and have my partner measure and insert an OPA. Does my patient tolerate?
Patient tolerates.
Alright, I will go ahead and expose my patient's chest, looking for anything that compromises breathing. Do I see anything?
See a gunshot wound to the left side of the chest making sucking noises.
Alright, I will place an occlusive dressing. Is my wound managed?
Yes.
Alright, I will assess my patient's chest, checking for paradoxical motion, and what is my patient's breathing rate, quality, and SpO2.
6 and shallow, 86%.
Alright, I will have my partner begin bagging my patient while I set up the oxygen at 15 liters per minute. Okay, does my patient tolerate the oxygen?
Oxygen is on and flowing.
Breathing, circulation. My patient didn't have any obvious bleeding. I already handled the bleeding that was there.
Yep.
Okay, I will measure my patient's carotid pulse rate and quality for no longer than 10 seconds.
106 and weak.
Noted. I will assess my patient's skin color, condition, and temperature.
Pale, cool, diaphoretic.
Noted. I will now move on to the rapid assessment for my patient. So I'm going to be checking for DCAT, BTLS, deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, lacerations, swelling, and crepitus for 60 no longer than 90 seconds. And any life threats. Do I see anything?
You find a knife sticking out from the left upper abdomen.
I will go ahead and I'll place a bulky sterile dressing around the knife and then a rigid object over top to stop movement during transport. Is my wound managed?
Yes.
Is there any other injuries?
You find an open knife cut on the lower abdomen with bowels protruding.
Alright, I will place a SMOB-D, a sterile, moist, occlusive, bulky dressing. Is my wound managed?
Wound managed.
Do I have any other injuries?
You notice profuse bleeding coming from the left leg above the knee.
Alright, I will apply direct pressure. Is my wound managed?
Wound continues to bleed.
Alright, I will go ahead and place a tourniquet to my patient. Alright, is my wound managed?
Wound managed.
Do I have any other injuries at this time?
No.
Alright, I will go ahead and treat my patient for shock. My patient is a high priority. No, I will not yet. I will go ahead and I will measure and apply a C-collar to my patient. Does my patient have any pelvic injury?
No.
Alright, you said no pelvic injury, correct?
No.
Alright, on my partner's count, we will log roll my patient.
1, 2, 3.
Alright, I will feel the posterior lumbar, back, buttocks, and thorax for any DCAT, BTLS, any crepitus. Do I see any blood drainage? Do I see anything?
Find an exit wound.
Alright, I will place an occlusive dressing. Is my wound managed?
Yes.
Alright, on my partner's count, we will log roll onto an LSB.
1, 2, 3.
My patient is now on an LSB. I will treat my patient for shock. My patient is a high priority for transport, and I will transport my patient immediately. I will now obtain my baseline vital signs. I'm looking for B-press, blood pressure, pulse. I'm checking the eyes for pearl, pupils equal round reactive to light, respirations, skin, color condition, temperature, SpO2, and blood glucose level if indicated.
Do you want me to read all those?
Yes.
Blood pressure 98 over 58, pulse 104 and weak, respiratory control with BBM, eyes are pearl, skin pale, cool, diaphoretic, SpO2 90% with BBM.
Noted, I will attempt to obtain a sample history.
Unable to obtain.
Noted, I will now begin my systematic head-to-toe assessment. Starting at the scalp, I am looking for any DCAT, BTLS, or crepitus. Do I see anything?
Lacerations to scalp with minimal bleed.
Noted, I will move to the face, checking for DCAT, BTLS, and crepitus. Do I see anything?
No.
Alright, I will check the ears, looking for any blood, drainage, any CSF. Do I see anything?
CSF coming from both ears.
Noted, I will check the eyes, checking for pupils equal round reactive to light. I will check for any redness, any contact lenses. Do I see anything?
Nope.
Noted, I will check the nose, checking for any blood, drainage, CSF. Do I see anything?
Nope.
Alright, I will check the mouth, looking for the acronym blood, broken or loose teeth, any obstructions, unusual odors, discolorations, or lacerated tongue. Do I see anything? Noted. Moving down to the neck, I will check for jugular vein distension, any tracheal deviation, and I will feel on the back of the neck for C1 through C7 step off. Do I feel anything?
JVD present.
Noted. I will move down to the chest of my patient. I will inspect for DCAT, BTLS, and crepitus, assess for any paradoxical motion. I will also take lung sounds, mid-clavicularly, mid-axillary, bilaterally.
No injuries, lung sounds clear on right, absent on the left.
Noted. I will move down to the abdomen, checking for any DCAT, BTLS, and TERDS P, tenderness, eviscerations, rigidity, distension, any pulsating masses, any surgical scars, palpating in all 4 quadrants. Do I see anything?
No injuries.
Noted. I will check the genitalia, looking for any soft tissue injuries or bleeding and priapism in males.
No injuries.
You said I did not have a pelvic injury, correct?
No injuries.
Okay, I will assess the pelvis, looking for DCAT, BTLS, and crepitus. I will press down and in on the pelvis, checking for any shift in the iliac crest. Do I feel anything? Noted. I will feel the lower extremities, checking for DCAT, BTLS, and crepitus. I will assess CSMs, feeling pedal pulses. Can you feel? Can you wiggle?
No injuries. Pulse is present on the right and absent on the left below the tourniquet. No response to sensory aid.
Noted. I will assess the upper extremities, assessing for DCAT, BTLS, any crepitus. I will feel bilateral radial pulses. Can you feel? Can you wiggle?
Anterior burns bilaterally. Pulses are present. No response to sensory or motor.
Noted. I will do a blood sweep on the back, seeing if there's any blood or drainage or anything that I missed earlier.
No injuries.
Did I miss anything? All right. I will now manage my secondary injuries.
Laceration of scalp with minimal bleed.
I will place a dry sterile dressing.
CSF from both ears.
I will place a loose, bulky, dry sterile dressing to collect drainage.
Abrasions to the face with minimal bleed.
Dry sterile dressing.
Burns to upper extremities.
Dry sterile non-adherent dressing.
All wounds managed.
All right, my patient was a high priority for transport. We transported my patient immediately. I will reassess vital signs, intervention, primary and secondary assessment every 5 minutes en route, and I am done.